influenced my life for many, many, many years. And I want to go right into a simple guided meditation, because it's something that I use for myself to get grounded and to be present, to leave the day that we've already had behind and to not get too far forward into our afternoon, into our evening. So if you'll just experiment with me this afternoon, if you'll get your body comfortable, maybe if your legs are crossed, just uncross them, just for the next 3 minutes or so. Putting your feet solidly on the ground, uncrossing your ankles. People will be arriving, but just focus on yourself. This is an opportunity for you to get present with what's happening in your body, to be present with what's happening in your mind space, and to be present with what's happening in your heart space. So it's just a simple body meditation, and if you feel comfortable in closing your eyes, I would encourage you to do so. And just start noticing how you're breathing. Start noticing if you're feeling open or constricted around your breath. Without having your breath change too much, just notice the quality. Bringing awareness to the soles of your feet as they're resting on the ground. Bringing awareness to your toes, your heels, the tops of your feet, your ankles, your calves, and your shins. Relaxing and releasing any tension that you may be feeling there. Bringing awareness to your knees, your thighs, your hamstrings, and your glutes. Allowing yourself to feel the support of the chair that you're seated in. Bringing awareness to your entire pelvic girdle. Softening and loosening any tension that you may be holding on to. And now taking in a mindful deep inhalation, exhaling through the chest, bringing awareness now to your entire belly and abdominal region. Oftentimes we have habitual patterns of holding tension there, so let that go. Just stick your belly out as if you just ingested the most amazing Thanksgiving supper. Nobody can see what's happening. Just loosen up that entire region. Softening, opening. Bringing your awareness to your torso, your heart and lungs, all of your ribs, your internal organs. Relaxing, releasing. Bringing awareness now to your low back, to your middle back, and your upper back. Allowing your shoulder blades to even slide down your back some. Seeing if there's any space you can create in between your vertebrae. Bringing in a nice, full, mindful, deep inhalation again. And exhaling completely. Letting go of all that is no longer serving you. Bringing awareness now to your shoulders, your upper arms, your elbows, your lower arms, your wrists, your hands, your fingers, and your fingertips. Softening and opening, becoming mindful of inhabiting your body fully and completely. Bringing your awareness now to your throat, to the back of your neck, the back of your head, the top of your head, your forehead, eyes, temples, ears, cheeks, nose, your mouth and lips. See if you can relax any tension that may be present in your jaw, letting the tongue just be present in your mouth without any constriction or tightness. And bringing your awareness to your breath again. One deep, mindful inhalation. Exhaling through the chest. One last time, inhaling. Exhaling through your heart space. You would know the secret of death, but how shall you find it unless you seek it in the heart of life? If you would indeed behold the spirit of death, open your heart wide unto the body of life. For life and death are one, even as the river and the sea are one. That is from Khalil Gibran, from the Prophet. Now you may gently open your eyes if they're not opened already. And I want you to simply notice if there was a change in your body sensation, if there was any type of relaxation or sense of presence or groundedness, if you became aware of some tightness that you weren't aware of before. I try and do this practice as I host events or before meeting a new family for the first time, maybe a little shorter of a version of that, just so that I can be present to what I'm experiencing, so that I can be more present to what the family and the patient may be experiencing. And even without the body scan, taking 3 or 4 very mindful, slow, deep inhalations with complete exhalations can really slow down your nervous system, your respiratory system, and your heart rate to allow you to feel centered and present and completely available for whatever it is that you're up to. So this can be very simple meditation and useful practice for anyone dealing with death and or stress, which most of us can understand on a day-to-day basis. What's happening today? Why I talk about this is because I believe that by exploring this topic and death as an event that will affect us all, and most of us multiple times, we can glean wisdom, practical knowledge, and experiences that will inform our life, our living, and our life choices for the better. I'm a death enthusiast because I am such a lover of life. If this doesn't make sense to you right now, hopefully it will by the end of our time together today. We are here to get death curious, right? So I'm so happy to see that so many of the seats are filled. It's become very clear to me in the last 5 years that the general public is really yearning and craving for more death and dying information, but they don't know where to go to get it. So you being present here today with openness and curiosity and grabbing the handouts and just showing up makes me feel like I'm on the right track, that we're on the right track, that I can hopefully impart some information and practical guidance to you today that will help support you as you do eventually face death and dying. We're exploring beliefs and ideas, sharing information. I'll share some with you, and later on you can share some with me, asking questions, empowering you, empowering self to find out what it is that you don't know about death and dying, advanced directives, green burials, home funerals, so that you can start thinking about how to make your life and death more comfortable. Developing a death to-do list. So that's one of the reasons why I handed out that resource list, so that if any of this information seems interesting to you, that you might make notes on the back of that. And who's here today? Well, you know a little bit about me. I was born in a small southern town in Goshen, Mississippi. I say that I escaped by the age of 23 by marrying my beautiful and smart Air Force husband. I'll give you just the brief details because it is a bit shocking to find out that a 27-year-old has been widowed. That was back on September 3rd, 1998. My husband went off on a regular nighttime training mission in his Black Hawk helicopter, and shortly after takeoff, his helicopter collided into another helicopter, and the 6 men on each of the aircraft crashed into the desert floor and died that evening. So, as Christine was saying, it obviously affected my life quite suddenly and dramatically, not just my personal experience, but also my professional experience. And it was after that experience, I had already been an RN, that I felt, okay, when I do go back into the hospice, to the RN field, it will be as a hospice professional. And that has been my journey for the last 16 years. I want to find out a little bit about you. If you're willing to show by raising your hands, I'm interested to know how many of you have been affected by the death of a parent, and the death of a sibling, the death of a best friend, the death of a partner, the death of a child, and the death of a beloved pet. Yeah, right. So as I mentioned before, death has already made itself quite tangible to almost everybody in the room, at different levels, different relationships. I'm curious also if anybody has had a recent loss, if you've had the death of somebody that you've loved in the last month, recent grief. Yes, thank you for letting us see you. In the last 3 months? 6 months? And a year, the last year. So there's grief present here too, and I want to acknowledge that, and showing up to hear a talk about death and dying, having recent loss. I just want to acknowledge your presence here with us. Life is here, obviously, animating me and you and our experience, but death follows every birth in life, every time. It's factual, inevitable, undeniable. So let's talk about it. Again, show of hands. I'm curious how many boomers are in the room? Okay, not quite half of you. Yeah, thank you for raising them so high. This is you, part of who you are, right? I'm not going to read this entire slide, but you can see how much power is in this information. You boomers are educated, you're change makers, you're policy makers. You can show us how to do it better. You can demand better care, you can demand quality care, you can say no to unnecessary treatments. You can be the way showers for those of us who will follow. So I want to say thank you. This slide reveals a bit about the scope of power that you boomers have. I'm very excited about that. So thank you for being here today. What is your relationship to death right now? Is it fear, acceptance, peace, concern, confusion, anger, denial, maybe some of you, uncertainty, maybe more of you? We all have relationship experience, right? Good and bad. But just for today, let's think about our death relationship, because that's kind of a unique way to context it. And what makes any relationship better? You can think about the relationships in your life. Understanding, interest, connection, spending time together. When we want to do something well, what do? You thought about that? And I think about driver's license, right? You study, you practice, you learn, you try, you engage, you fail a lot, you try again, you assess, you reassess. You learn how to integrate new ways and try new strategies so that you can become successful. So we can do that with death too. Your death relationship is personal, and it's uniquely yours. No one can do it like you, and no one, unfortunately, can do it for you. No one can truly understand your own experience of death and dying, but hopefully they can empathize with you. That your experience is valid, whatever it is for you. It's true for you. It's real for you. That means it's valid for you. Your relationship is personal, obviously, and it may be private. Some people have a death and dying experience and want to contain it and don't want to share their journey with anyone, and that's completely your right. And we should be respectful of that. Some people are going through their process and they're doing Facebook status updates every other day about what's happening with their treatments and that they need support, that they need a ride. So whatever it's going to be for you. You are free to change your mind at any time. So maybe you've been private, but now you're feeling nervous and want support, so reach out and get it. It's okay to do that too. Nobody's going to hold it against you if you do change your mind about something. And if they are going to hold it against you, maybe you should think about that relationship changing. Surround yourself with people who can support your process, emotionally, spiritually, mentally, and physically. That's a lot, but they're all very important. because as we go through our life cycle, it's good to know that we're not just our bodies, that we're not just our minds, that we're not just our thoughts, that we're not just this spiritual experience. And I want to, for the context of this conversation, just so that it's not confusing, to let you know that spirituality is defined as the praxis and process of personal transformation, either in accordance with traditional religious ideals or increasingly oriented on subjective experience and psychological growth, independently of any specific religious context. So in a more general sense, it may refer to almost any kind of meaningful activity or blissful experience. So spirituality is pretty much wide open. You can be in relationship with the trees, or the ocean, or the rocks, or the mountain, or a nice cashmere sweater, and that may be quite spiritual for you. I just want to say thank you to Wikipedia for that. And I thought it might be interesting to explore the concept of death and dying in the context of a romantic relationship. So bear with me, because it is, after all, a very intimate and personal experience. So let's just, for the time being, experiment with this idea that death could be like a bad blind date. Have you ever had a bad blind date? Yeah, me too. I should raise both hands for that. Nerve-wracking, unexpected, awkward. Oh, just wishing it would be over. Is he going to try to kiss me? Confusing, overwhelming, a lot of emotions and sensations, and not having anything in common, right? We think, death? No, I'm alive. I have nothing in common with you. Can't quite relate to what's going on here. Death can also be like a shotgun wedding, unplanned, as it was for me, trying to do the best with what you've got, getting others involved, fast and furious, pleasing others, emotionally charged. The guest may not be getting along, and there probably may be some shame or hiding related to that. And death can be like the long haul. Do you guys know what I mean by that, long haul? Yeah, some of you are in long haul relationships. No judgment. Planned out with mostly expected outcomes. Chronic issues arising. It can wear you down. Been there, done that, maybe a feeling you're experiencing. No passion, no new possibilities, just waiting for it to be over. Experiences of regret and guilt, thinking about what you should have or could have done. Now the flip side, the good news. Thanks for staying with me. By understanding that your relationship with death and dying can be like other good and healthy relationships in your life, death can also be like the perfect partnership. Again, maybe we should stop and take a breath here, just to open up to that possibility. That's all we're doing today. That's all I'm trying to impart today, is maybe a new way of thinking about something that might elicit some sense of comfort and ease in you. Comfortable, that's a good sign of a nice partnership. Familiar, gentle, present, thoughtful, timely. Well, that's a good one. I could talk about for an hour the timeliness that death has sometimes, and the generosity that death can offer in timely moments. Kind. You're wondering how is that possible? The traits in any good relationship can also be present for this death and dying relationship, with work, awareness, and effort. I didn't say it was easy. I just want to offer that it is possible. Respect, communication, honesty, purpose, acceptance, and compromise. Acceptance can be a hard one. I know, I feel you out there thinking about that. Do you all know Byron Katie's work at all? She's a very interesting woman who writes about reality. So any atheist or agnostic or very pragmatic people in the room might find her work quite interesting. She says you can argue with reality, but you're only going to lose 100% of the time. Right? Acceptance doesn't mean that you agree. It means working with what is. And with compromise, knowing how far you can go, releasing the rest, becoming non-attached to the outcome. But as you and I both well know, we are very attached kind of beings, and working on non-attachment can be a lifelong process. letting go, releasing, not having expectations of outcome, doing your best along every step of the way. It's a mission. Taking it to the next level for those of you who are following in this experiment today, these traits can be expressed during times of death and dying. I have been witness to them thousands of times. The tenets of any great relationship: inspiration, teaching and learning, joy, play, understanding, admiration. There are gifts in death and dying. There are gifts in death and dying. Increased tolerance, patience, perspective, authenticity, increased courage to do those things which you've wanted to do but haven't yet, confidence, inner stability, wisdom, and increased grace. Increased grace. These are some of the gifts my husband, death, has revealed to me. I know some of you are ready for some more practical information. I haven't forgot about you. So here we go. Learn how to be your own best advocate. Get educated. It's part of why you're here, part of why you're readers. Get online. Ask your doctor for alternative options. Consider your quality of life versus treatment. Get connected, meaning to your friends or family or community. Get support. A lot of us are caregivers, and it's very hard for the helper to receive help. So it's really important to identify what your needs are so that you can ask for what you need. Does anybody relate to the problem of that doesn't ask for the support that they need? This is a great opportunity to think about that in a different way, that you deserve support. There are people in your lives that are waiting to give you support, so let them. Get your affairs in order, no matter what, now, today. Hopefully you'll make some notes today. As I mentioned, I gave you the resource paper that is one of these slides also. Make this to-do list personal for you, unique like you. Go as deep as you would like. This is just a start. This is a partial list. I'm not going to go into detail about all of these today, but I do want to talk about a few. So I'm curious again, by a show of hands, who here has an advance directive or a living will? So maybe that's about 30% of you. Thank you for raising your hands. I know this family has living wills in place. We talked about that. This is an example. This is out front, so if you didn't pick one up and you need one, this is what it looks like on the table out front. This is a very simple version donated by Hillside Memorial Park, who is the current sponsor of the Death and Dying Dinner Party that I host every month. So they've generously provided this free document. An advance directive is extremely important for you because if you find your body in the healthcare system but have lost your voice, then we don't know what's going to happen to you. If you've had a major stroke, or if you've had a massive heart attack, or if you come in a vegetative state, if you've had some traumatic injury and your body makes its way into the system, they are going to do everything for you and to you to keep your body alive. But that may not be what you want. So an advance directive or a living will is for the medical setting. It is for you to choose who will be your voice in case you lose your own. And you choose your number one advocate, and then you have a second and third alternate. So you want your advocate to be educated. You want it to be somebody who respects you and cares about you and will follow through with the wishes and desires that you have about your health and your treatment plan. And you want to be sure to communicate with them that you've actually chosen them to be this person for you. It talks about, do you want to be resuscitated? Do you want to have a DNR in place? Do you want to have artificial nutrition, a tube going into your stomach or a tube going into your vein to give you nourishment or hydration to keep your body going? You can also talk about things like, do you want to donate your organs? Do you want to have your body be researched by UCLA? Do you want to be buried or cremated, or do you want to be turned into a firework or a diamond? If you Google online, there are so many things that can happen now to the dead body. It is astounding. You can become a reef in the ocean, right? So the idea is also to make sure that you've considered the use of narcotics, the use of antibiotics. I don't know if any of you have heard that pneumonia is an old person's best friend. Do you know this saying? One of my patients several years ago taught me about this. Pneumonia is not a painful death. The issue is that elderly people, 90s, we're all living longer, keep rotating through the emergency room, right, because of infection or a UTI or some lung issue. And we can continue to pump the body with antibiotics, but after every ER run, there's some quality of life that's been diminished. So the idea is to figure out what your line is. Where are you going to stop? You don't have to continue to go to the ER. You can opt out of a treatment as simple as an antibiotic and have the infection be your exit strategy. Does this make sense? This is an option that not a lot of people think about. Yeah, so I just wanted to add that. It has information about how far do you want to plan your memorial service or your celebration, right? What kind of music do you want to have? Do you want to have a jazz band or some quartet, or you want to have some Irish jig going on? I don't know. But if it's important to you, put it in the document. Once you've figured out what you want this document to express for you, of course you want to share it with your number 1, 2, and 3 person. You want to keep a copy for yourself. You want to give a copy to your physician and make sure that you verbalize with your doctor all of the things that you want and all of the things that you don't want, so that you can be respected in this decision-making process. I've seen over time and again in the hospice setting that my patients don't have this document in place, and what happens is that the adult children are not on the same page, and they're fighting about, do we stop the tube feeding or not? You know, it becomes a lot of angst and anger in the family setting that is completely unnecessary if the patient were to make this decision for themselves. So this document is your wishes, it's in black and white. The family doesn't have to argue about it. They can see what you do and don't want, and it can alleviate a lot of pressure that they may feel if you haven't taken the time to figure this out. So when I talk about empowering yourself, this document in particular is a gift for your friends and your family, so that they don't have to make choices for you. They don't have to guess what it is that you do or don't want. I want to talk about this POLST, this Physician's Order for Life-Sustaining Treatment. This is a document that's come out in the last couple of years. Are you familiar with this document at all? No. It's a bit of a hybrid between a do not resuscitate and a living will. So if you don't have either one of those, you probably don't have a POLST. However, this document is signed by your physician, and it's a good document if you're going into the hospital setting and you have chronic issues, if you've had diabetes for 40 years, or you have advanced heart disease, or advanced kidney disease, or advanced lung disease, and your time in the hospital may be tenuous, and you are a do not resuscitate, and there are things in the living will that you want to be noted, that this order can stay in your medical record. So the next time you go for a regular checkup, talk to your physician to find out if this particular document would serve you. It may or may not. The living will certainly serve you. Some of you are very vital. I don't imagine you will need a DNR, but some of you may have already contemplated and have a DNR. So we just want to make sure that you're getting as much information as you need, but certainly you need to have conversation with your healthcare provider to help it make more sense to you. I want to talk about home funerals. I don't know if you realize that what happens at the time of death in general is that the funeral home gets called and the dead body is whisked away in a matter of an hour or 2. Did you know this is what's happening? And what I've found over the years of being in hospice and working with people that are going through this process is they need more time with their loved one, but that society has somehow succumbed to the strange pressure of the business of death and dying, and you thinking that you don't have the right to have their body at home with you. You certainly can have their body at home with you. You can have their body at home with you for a day or 2 or 3. There is actually a professional that will come and I know this may sound crazy, they'll put your loved one on dry ice for a bit of preserving, so to speak, so that it can be like it was in the old days where you had a wake, right? And you can set your loved one up wherever it feels comfortable for you. Flowers, food in the kitchen, people can come through the house, right? Slow and steady at their own pace. They can spend time with that dead loved one, helping to start their healing process, helping to start the grieving process. What happens is that now at the time of death, the body is ripped away before the tears can even begin to flow, and it extends the bereaved process. It complicates the grieving process. We just don't even know that that's what's been going on. So there are, again, this resource list has some of the information. If you're interested in having this ritual in your home, that you can be with your loved one, even if it's just for an extra 4 or 5 hours, just so that you can know, you can ask for that. There may be people telling you that the body has to go, but it's absolutely not true. And I don't want you to suffer any unnecessary angst or confusion or shame or regret by giving that up, by giving that power over. So be sure to ask for what you need and to know that they can stay with you so that you can touch them. You may want to wash them. You may want to sing to them. Whatever it is that you need to do to help start that grieving process, to honor you and to honor them. Does this make sense to everybody? Yeah. They also have green burials now, which is a whole very interesting thing. Hillside Memorial Park has it is a Jewish memorial park, so not for everybody, but Joshua Tree has a green burial. There's one up in Northern California, meaning that it's going to put you back in the earth in a much more natural way without the concrete going in, without the expense of that as well. For those of you who are in the green movement, you can have a green death too. Writing your own eulogy. Have any of you ever experimented with that exercise? I see 5 or 6 hands. Yeah, maybe 7 or 8 hands. This is an amazing way to understand where you're at in your life. And is this okay with you? How are you doing? Is it adequate? Do you want to be doing more? Do you have things that you need to rewind and make amends for? It's interesting to think about writing a eulogy from where you are now, at 44, or at 80, or at 100, to really sit down for maybe 20 or 30 minutes and think about your life in a life review. What have you accomplished? What's your legacy? Who are your heirs? And what I really like about it is you can think, are you on your path or have you stepped to the side? And without judgment, just come on back to where it is that you want to be going, right? And the other thing that I like about writing your own eulogy is when you think about who will be there at your service. Are these people that you feel really connected with? Are these people in your life that inspire you? Are they people that deplete you and drain you of your energy? And if that's the case, if you're writing your eulogy and imagining that you're 90 and there are people there at your memorial service that make your skin crawl, this is a big signal maybe to think about that relationship and how it's not serving you, right? You don't have to keep people in your life that you don't want to keep in your life. I'm giving you permission today to let them go because your life is so precious and it's so valuable, and you don't need to waste any time with any relationship that isn't mutually beneficial. That's just my soapbox moment. I have companies listed on this resource page here for you to consider. Sacredcrossing.com. Olivia Barham is a woman who has a home funeral. And Friends Alternative Funeral Home in LA, if you want to do something crazy like have a biker funeral or go off to sea. My friend Ziri Ridu will help you with that. Getting involved locally with death and dying, well, you've done it today already, so you can check that one off. You've come to a talk at the library, and you're exposing yourself and opening yourself up to new information. There are death cafes. There's an entire movement happening with the Death Cafe. My friend Betsy Trapazzo is the LA hostess of the Death Cafe, so if you go online and check out that.com, you can see where the next one might be. I've been hosting what I call a death and dying dinner party for the last 5 years. I'm having the 60th death and dying dinner party tomorrow night. So there are 2 seats left if anybody here wants them. I'm going to tell you a little bit about why I started the Death and Dying Dinner Party, because what would happen as a hospice RN, I would arrive at a patient's home for the very first meeting, the admission assessment, where I'm going in to try to figure out what they need, where they are in the dying process, to get them medical equipment, to get them set up. And I would walk in and I would take a look at the patient and I would realize that they were dying. And I would realize that they were going to die while I was there. And my entire visit had to change, right? I couldn't talk about music therapy or pet therapy or even spiritual counseling. I really had to focus wholeheartedly on, were they comfortable? You know, how was their breathing? Was their body comfortable? Was their family aware of what was happening? It creates a lot of tension, a lot of confusion. They're thinking they're just now getting hospice and that they have more time, and I'm arriving and I'm telling them they're dying and they're going to die in the next hour, or they're going to die in the next 10 minutes. Can you imagine how confusing and disheartening that is? So there's a complete stranger coming into their home and I'm telling them that death is here. And this happened dozens and dozens of times to me personally. So as you can imagine, there are lots of hospice nurses out in the LA area. If it was happening to me, it was happening to other nurses. That the physicians are not connecting patients to the hospice program with enough time for them to get the benefit they need, for a variety of reasons, and I won't go into those. But what I realized was that I could only make an impact at the point of entry in my profession as I arrived at the door, which I did, and it's always better to have hospice present than not present, because if we're there, we don't have to call the cops. You don't have to have people in suits coming in. We can just go a little slower and get you what you need, find a funeral home, and just slow down the pace without having police officers present, right? But I realized that I was limited in this way as an RN, and what I needed to do was talk to people like you, talk to people that aren't dying, get you educated about what's possible with treatment, with not treatment, with programs that could serve you and support you and the people you loved. And so the Death and Dying Dinner Party was birthed, and I host a potluck table where 10 to 12 people gather, and you're allowed to talk about anything you want as long as it's related to death and dying, so that people come and they explore their fears and concerns, they tell stories, they ask questions, they get educated, and then they go back out into the community and they help to provide guidance and care and wisdom to people in their lives as they enter the death and dying process. So it's been a 5-year process of really trying to disseminate information more to people that don't need it yet, so that you can settle in with it, integrate it, and then when you need it, it's available. You feel more calm, you feel more confident, you feel ready, and more prepared to face death. And again, as I mentioned, this list, which is long, is only a partial list. As I mentioned earlier, I'd always wanted to be a hospice nurse, but early in my career, I didn't think it was possible. I wasn't old enough, and I certainly wasn't experienced enough. But 2 days after my husband died, I had great clarity. I woke up and I realized that when I did go back to nursing, it would be as a hospice RN. I took 2 years off just wallowing and grieving and being very confused about what had happened to me. Now I understand for me. But when I did go back to nursing work, it was as a hospice RN. And I want to let you know that although it's been some of the most challenging work that I've ever done, it's been the most rewarding. There are families here in the audience that I've had the pleasure of taking care of their partners and loved ones, and without naming them, I just want to acknowledge their presence. And some friends that drove to see me today, fellow widows that have not only survived but thrived. And this slide is an overview. Hospice is a philosophy of care and is appropriate for anyone who has a prognosis of 6 months or less and who has foregone curative treatment. Hospice is a Medicare and Medicaid benefit. Most private insurances also have a hospice benefit. You may keep your current MD if they're willing to keep you, or you can use your hospice medical director. And you can revoke, meaning you can quit hospice at any time, and you also may change hospice companies if you're unsatisfied with the care. And a lot of people don't know that. They sign on to a hospice that their doctor has recommended because they're trusting that, and then they're met with people that don't understand what they're trying to express, and they don't know they can ask for a change. So I'm letting you know that you can. Hospice care helps to manage the dying process by providing, hopefully, education, medications related to the dying process, medical equipment, social workers, home health aides. The home health aides are the beautiful men and women who come in to help with personal hygiene needs as that dying person loses the ability to take care of themselves. Spiritual counseling can be offered, pet and music therapy. Hospice does not provide long-term care. If you don't have a primary caregiver, unfortunately, you can't be enrolled in the hospice program. So there needs to be someone who will be the number one person to manage that dying person's care at home, because the hospice staff will simply come in and out of the home. Hospice does not equal death. Hospice neither hastens nor prolongs life. Hospice neither hastens death nor prolongs life. Death is just happening, and hopefully hospice can be a guide. You may not know, but some people recover and some graduate from hospice. Yeah, it's really kind of sweet. There may be an elderly woman who's on her own and has been for years and has become debilitated. The doctor sees that. She's lost weight. She's more isolated. The doctor thinks, I think she may die in the next 6 months, and enrolls her in a hospice program. What happens? The nurse comes 2 or 3 times a week. The home health aide comes to lotion her body and her feet. Pet therapy comes. Somebody comes to play music for her, her favorite music once a week. What's going on? She starts engaging in life more. She starts eating more. She starts telling stories. She starts becoming more animated. She's gaining weight. Her symptoms are improving. And then she goes to see the doctor, and he says, "You're not hospice appropriate. We have to graduate you." So she goes off service. So that can be a good thing, right? But it can also be a bad thing, because then all her services go to the side. But just so you know, that's the point of hospice care, is that we're trying to support everybody in the home, not just the patient, but the friends and family who come by, to understand everything about the process. But hopefully, that little old lady, maybe she got connected with a volunteer through hospice, and maybe that volunteer will continue to go see her. That happens also. Very meaningful relationships come out of that hospice enrollment. So research has shown that merely by having hospice care in place, that often life is prolonged. And I'd like to dispel some hospice myths here today. Hospice care means giving up hope. Choosing hospice care in no way means that a patient has to give up hope. It simply may mean redefining hope. Hospice means that I have to sign a DNR. I've seen a DNR signed maybe 70% of my patients' homes. It's absolutely not necessary. It's simply helpful, but at the time of death, if everyone has agreed not to call 911, then they simply call hospice, and we come and we follow through with that situation. So it's not necessary for you to sign a DNR in order to have hospice. Hospice is only for cancer patients. It's not true. It can be for ALS, for heart disease, lung disease, Parkinson, end-stage liver or kidney, dementia, and many other diseases. Your physician will know, and you can research that as well. Hospice is only for patients who are close to death or actively dying. It's unfortunate that often that is what we see at the time of admission, but it doesn't have to be that way. It's better to have at least a couple of months to adjust to the program and to reap the benefits that a good hospice team can provide. Hospice helps you die. What's more true is that hospice helps you live while your body is dying. Hospice will get you addicted to morphine. Have you heard this? Whoa. The use of morphine in an in-home setting in hospice has its own very unique challenges, not just through disease process issues, but also culturally, and also the fact that the family may have hired somebody to administer the medications that isn't on the same page as the patient or the family. So morphine can create a lot of fear and anxiety in families because they don't necessarily understand that the point of using it is only to alleviate the symptoms, which could be pain or could be increased breathing. Somebody who has lung disease, you may notice is their chronic way of breathing day to day. But if you just give them 3 or 4 drops of morphine under the tongue, they can come to a regular respiratory rate, just like you or me, right? So morphine is an amazing narcotic, and we're not giving it to push you over the edge. We're giving it to make you more comfortable. And I understand this can be confusing because in the hospital setting, they have protocols to help people when they go on to comfort care protocol, and we think they're going to pass in the hospital. In the home setting, it's quite different. You have a lot more control over the amount and the frequency with which you give medications to alleviate the symptoms. So morphine is usually only used when needed and started in small doses in hopes of alleviating the symptoms. It is then titrated up as needed, meaning that we may start a 5 milligram dose, and that may be adequate for 2 or 3 weeks, and then we may go up to a 10 milligram dose, right? Then maybe a month or 2 later we go up to a 15 milligram dose. But we always give it, wait and see how the person responds. Was that too much? Was it too little? How long was it effective? And then we go back in. There should always be assessment, reassessment, and a titration of medications. And if your healthcare provider isn't communicating all of this with you in a way that you can understand it, you need to let them know, you need to ask them to slow down, or you need to ask to speak to somebody else. As I mentioned, if it's not the case that the morphine is doing what you think it should be doing, then more communication needs to happen between you and your healthcare provider. Again, this is where it's so important for you to get educated and to find your strong voice. Palliative care is the umbrella under which hospice falls. So palliative care aims to provide comfort and quality of life to anyone at any point in time along the healthcare continuum. So imagine that the umbrella is palliative care that you can access at any point in time that you need it, but hospice is at the tail end. Hospice is when there's no more treatment, they're no longer seeking curative care, but you still want the comfort, right? So it's at the tail end of your life experience. Anyone having pain or unmanaged symptoms is appropriate for a palliative care consult. And since 2006, MDs are now specializing in palliative care. In 2008, over 81% of hospitals with more than 300 beds have a palliative care program. However, most medical schools don't require hospice or palliative care program, so it may be up to you to ask. So imagine that most of the physicians that are practicing medicine for treatment and for cure have no education around death and dying, much less comfort care. So you see the quandary, right? That's why I need to get to you. That's why I need to educate you, because you, unfortunately, may have to educate your physician, which is what I see time and time and time again. We get as many referrals from families and friends of dying people than we do physicians, because physicians, for whatever reason, don't want to hand over the care. I don't want to guess as to why or make up stories about it, but it's actually what's happening. Some are becoming better equipped at having the conversation of death and dying, but oftentimes they refuse to tell the dying person that that's what's happening, because there's always another treatment to do. There's always another blood test to have. You can always play with the chemistry in the body, right? So they may not offer to you that maybe it's time to go home and be with your friends and family, to settle down and to guide you in the way of comfort and ease and grace around dying. So again, this is a very pertinent point, and I want to be respectful of MDs and physicians that are caring for so many of us, but I also want to be respectful of you and your process and your life, and that you can exit much more peacefully than you may have imagined. Who here has an active fear of death? Okay, hey, that's pretty good. I mean, not necessarily good for you, for those of you that have fear, but that you're a small percentage, right? So I'll let you read this for yourself. I'd like to help you reframe that. I'd like to help you reframe your fear of death. How? I offer you 10 concepts to help you start to understand that death can be of use to you. Death can show you something. Death can teach you something about yourself and about life. Some of these concepts you are aware of, some maybe not. Death offers us a new perspective. It brings us fully in to the present moment. It demands that we learn to let go. It teaches us the value of forgiveness. And those of you who have held on to forgiveness as death has been present can really relate to that one. Death reveals our interconnectedness. Death says, now is the time to express yourself. And if you haven't up till now, you may as well. Death encourages us to be flexible, adaptable, and willing to change. Death teaches us that kindness and compassion are the true currency of life. Death gives us the chance to learn about who we are. This one I really like because my experience at the deathbed and being in strangers' homes and leaning over that deathbed and looking face to face and locking eyes with somebody as they die, there is nothing else there but their essence. There's no energy for the mask anymore. You know, the mask that we wear of good nurse or good son or good Samaritan or great professional or whatever it is that we're doing, the mask that we hold so tightly and that we're so attached to, there's simply no energy for it to be present. So it's gone, which is so revealing and can be so vulnerable for the person that's dying. But as I go in with quietness and respect and concern for them, and we lock eyes, I get to see who they are. I don't even know what they've done in their lives, if it's been good or if it's been bad, but I see the truth. I see them in that moment, and we're connecting to true humanity, true compassion, and we can have access to that right now. So again, it feels like a little bit of a soapbox, but if you want permission to take off the mask, I'm giving it to you. To be more true to yourself, to be more authentic in the world, to risk being seen for the true beauty that you are. And death wants us to get practical about living and dying, which is what we're doing today. If you're interested in more, I expound upon these ideas in a 30-minute video on my website at laurellewis.com, which is the last resource on that page. Relationships can be damaged forever because people run away from death and dying, or they are not mindful about how to behave, mainly because no one is teaching them and we don't have a lot of practice. People are often not equipped to deal with this kind of situation, and because of feelings of fear or inadequacy, the dying are often left abandoned by the people they need the most. Have you seen this happen? Has it happened to you? It happened to me. So I wanted to offer you some death and dying don'ts. The do's will follow. Deception, being patronizing. I know how you feel. How is it possible that they know how you feel? How is it possible that anybody but you knows how you feel? If I were you, I'd do this. If I were you, I'd do that. At least you're young enough to get married again. You've heard somebody offer after a miscarriage, well, at least you can have another baby. Second guessing the patient. Minimizing the dying person's expression or experience to make yourself feel more comfortable. Oftentimes, it's such a habitual way of being, we don't even know that's what we're doing. The dying person may launch into revealing something that they've been holding on to for the last 20 years, and it starts to make you feel uncomfortable in your stomach, or your heart starts to race, and you start to feel constricted, and they're starting to open up, and you say something really stupid like, are you hungry, or is it too cold in here? And it shuts them down, right? Can you imagine? They've waited so long to open up and reveal to you, but because of your level of discomfort in hearing it, you close them down. Again, don't be harsh on yourself. It's a habitual way of being. Maybe you don't even know that's what's happening. So I just want to shine some light on that, right? That if you're being with somebody and you're starting to feel uncomfortable in your body, just be aware of it. Try to be really open to what it is that they're trying to express to you, and try to calm yourself down enough to hear what it is they have to say, because it may be the most beautiful opportunity for an intimate connection that you've ever experienced. withholding options, meaning not telling them what's possible, doubting their resourcefulness or creativity. That happens all the time anyway, but it's exacerbated at the deathbed. We imagine that somebody's getting weaker and weaker, they're losing their minds, which sometimes they are, but there is this life creativity that is present for all of us, and to hold out for that as you're looking at them and you're looking in their eyes, to trust that they're resourceful, to trust that they're creative, to be their cheerleader and champion. That's what your role should be. Giving unsolicited advice, whoa, this is the grandfather of all of these. If you want to tell somebody what to do, at least have the courtesy to ask permission to do that. Just don't flat out give it. For a couple of reasons, it's probably not going to land. And if it does, it's probably going to make them angry or confused about why you're bossing them around. These may seem simple, but they may not always be easy. Being present. And again, it's part of why I had us do that meditation at the beginning. Because if you noticed a change in your body, if you noticed yourself more relaxed, then you were more present. Being completely honest about your experience and showing up wholeheartedly. Be available. Keep your word. Oh, this is a good one for me. When my husband died, people would say that they were going to do things and then I'd never see them again. That was not cool, and it also damaged the relationship. So if you're going to say you're going to do something, then do it. But if you're not sure you're going to do something, then just don't say it, right? You can still do it, but don't say that you're going to do it, because that other person then may have an expectation that may not be met, and then that complicates the grief process and changes that dynamic. Share truthfully from your own experience. Acknowledge the importance of the person, the relationship, what it has done for you, so that they can understand what kind of legacy their life has had. Learn about the use of silence. Do we have any chronic talkers in here? You're so quiet right now, but some of you are probably chronic talkers outside of this room. That can be habitual. It could be a defense mechanism. It could be that you're uncomfortable with a part of yourself. And what that is, and what that tells me, is that there's a part in you that is craving for you to be silent so that you can come home to yourself. You know, using silence with somebody can again allow them the opportunity to blossom and to reveal and to open up to you. It can be awkward or uncomfortable initially, but just give it a try. Just experiment. Get support. And I don't mean from the dying. You know, sometimes I see that happening, that somebody's distraught or distressed and they're telling the dying person about it. That's a complete no-no. That person doesn't need any more of that, right? They have their own issues to worry about. And just let me plant the seed in your mind that you may be losing the relationship with the dying person, right? You may be losing that one relationship, but the person, as they're lying on the deathbed, is contemplating losing all of their relationships, right? Do you see this? This is a big issue. They're contemplating leaving behind everybody that they know. And I only have to contemplate having that relationship change. So if you need support, get it from your friends, get it from your therapist, get it from a walk outside, but do not get it from the person who's dying. And you can say things like, I can't imagine what you're going through, but I'm here to listen if you want to talk. And this can't imagine is a very good phrase, because it's true that we can't imagine, but that you're interested, right? So just say as much. I can't imagine what it's like for you, but I'm certainly curious about it if you'd like to share. Run errands if needed. And overall, respect the dignity of their process, because it's their process. You will have your own in your own time. Some of you may be thinking about when to stop. Or maybe thinking about when to stop getting treatment for your mom or dad, if you have the power of attorney for health care. If you still have your voice, it's your decision to make. Weigh the benefit of the treatment to the cost. The cost financially, the cost physically, the cost emotionally. And as an example, what I mean by that is you could be going to get radiation twice a week, but every time you go, you're exhausted for 2 days. So what is that quality of life for you? Is that treatment what you want to be doing with the rest of your time or not. And again, only you can decide. Just because it's offered doesn't mean you have to take it. How will it affect the quality of your life? Ask your healthcare team about all of the options. Breathing tubes, antibiotics, blood transfusions, scans, blood work, feeding tubes, artificial hydration, dialysis, for comfort, for cure, or to prolong your life. And don't spend time arguing with people who don't support your decisions. Again, you have my permission to let them go. These signs and symptoms are normal. Most people don't know, again, because we haven't been exposed. What dying can look like: withdrawal, emotional and physical, isolation, decreased food or fluid intake. A dying body does not need food or fluid. Offer it, but don't push it. Less mobility, more sleeping. Somebody could go from sleeping 8 hours a day to 12 hours a day to 20 hours a day. Exacerbation of symptoms, and by that what I mean is worsening, a worsening of symptoms. New symptoms may arise, such as pain, breathing problems, confusion, restlessness, agitation, which could be mental, physical, or spiritual, which leads into the dark night of the soul, which some of us have already faced, but we may face again for those of us with major unresolved issues. Now, I have to tell you that the deathbed experience and dying, can bring all of your dysfunctional family issues to culmination, and it probably will. So brace yourself. If it's kind of iffy right now, it's going to get a little more volatile, no doubt about it. So mitigate that. Do what you can to prepare for that. A change in vital signs: the blood pressure may go down, the heart rate may go up, the respiratory rate may increase, and skin changes, meaning if they're not eating or drinking a lot, the skin may become thin or brittle. You may tear easily, may bruise easily. Bed sores may be found. Sometimes those can be prevented, sometimes they can't. Options for care. These are some options for care settings. Home care, obviously, in your apartment or your home or your studio or your friend's house. Assisted living, in-house hospice. There is a new social hospice nearby in Topanga called Anamkara, which is almost ready for patients. Definitely worthwhile to investigate them. Their website is on the resource page also. Skilled nursing facilities. You can hire outside help. You can organize your friends and family. And you can use the medical system. You can go in and out of the hospital, go in and out of the ER, and you can die in the hospital if that's what you want to do. I'd like to offer additional emotional support for this process. Dr. Iyer Bayak, who's now a California resident, which is really nice, writes about the 4 things that matter most, a book about living. 4 simple phrases. Please forgive me. I forgive you. Thank you. I love you. Please forgive me. I forgive you. Thank you. I love you. These carry enormous power to mend and nurture our relationships and our inner lives. These 4 phrases and the sentiments that they convey can help us resolve interpersonal difficulties with integrity and grace. Using these phrases can help heal and mend relationships at and around the time of death. And by now you've probably figured out that if it's useful at the time of death, then it's useful today. Another book I recommend is Through the Dark Forest, Transforming Your Life in the Face of Death by Carolyn Conger. She's a local guru and mentor, very humble. She has an entire chapter, chapter 3, called Examining Your Beliefs, which I think is a must. These are some of the questions that she offers for you. This is just a portion of them. Do I believe someone at my stage of illness can recover? What are my spiritual beliefs about the death process? What do I believe about the afterlife or the afterworld? Where am I going? Am I going to like it? Am I going to disappear into nothingness? Who knows? I don't know. How do I feel about it? How is it going to affect my dying? When it is time for me to leave this earth, what do I believe is important for me or others to do, if anything? Again, these questions are meant to support your process and support you in cultivating a healthier relationship with the one thing we will all face. Gratitude is a foundation of my way of being. So I want to rewind and thank you for the questions, and I want to offer my gratitude now for you, for being in the audience, for Judith Graham, who was just up here with me, for Kristen, the library staff, for Danny, who helped with the mic and the slides, for my mentors, some of whom are in the room today, for the people that entrust me with their secrets, and I hold a lot, for the patients and families who continue to teach me about death and dying. I'm so grateful. For my deathiz.com mission, for the death and dying dinner parties that are sponsored by Hillside that are ongoing, and for Adele Clark. Adele, would you please stand up in the back? I know you probably don't want to. Adele Clark. She made all of this possible. She is my friend. She is my mentor. She is my inspiration. What's that? Who is she with? The library? She is with the library. And she's with me, and right now she's with you. So we're going to just let's take a deep breath in together before we close out. And exhaling. One more deep breath in. And exhaling. Death must be so beautiful. To lie in the soft brown earth with the grasses waving above one's head and listen to silence. To have no yesterday, no tomorrow. To forget time, to forgive life, to be at peace. So I want to share with you the stories of one of the most meaningful and impactful hospice experiences that I had. I want to share a little bit of my writing. This is called Intermittent Disappearance. I watch him fade. I watch his mind go and go and go. I wonder if the next time I see him, the tears will spill over my eyelids. His intellect has gone. His humor is following. I imagine in the end, his kindness will pervade. Ironic how sometimes what has served us so well in life has no place at the deathbed. His mind could not get him out of this predicament. Actually, it is his mind that has put him in bed for what will be the last months of his life, vascular dementia. His brain failing with each passing day. I watch him fade, as does his devoted wife. Her life on hold, while his process rules her days. We speak more simply now and talk about the flowers that are his constant companions and the shiny knobs on the closet door. He knows my face, but not my name. And his eyes smile, still. I feel my heart open for him as I watch all normalcy disappear. He no longer bathes or dresses himself, and in the near future, he will no longer be able to nourish himself. His independence vanished a long time ago, and a sweet man named John comes to do for him what he can no longer do for himself. I am watching him lose his mind. It is truly a first for me. It is surreal. I know that as surely as a child grows into a better understanding of how to navigate in this world with each passing day, that this kind and gentle man will lose all of those bearings and become unable to communicate with any meaning. His life is in terminal rewind. I will stay and watch and try not to ask why. I play my part as a watcher and supporter, as a fan of kindness and service. I act as a cheerleader to his loyal and tired wife, and as a champion of those who care for those who can't care for themselves. I pray for the strength to see him smiling when he is no longer capable, and for the courage to bear witness to the dimming of his days. I found out on my last visit that he was a doctor, a PhD 3 times over. And today, instead of giving me his regular confused, strained response, when he did respond, he did so in song. My heart swelled again with affection and admiration for the soul embodied in the failing frame. He has the sweetest face and kindest smile. Day to day, he is intermittently disappearing, losing his education minute to minute. I can see and feel that what remains is his love. We hold back on his meds in order to keep some semblance of him in our sights. We will lose even this shadow of him soon enough, and his wife cries as we near the end. A second phone call to an estranged daughter with no reconciliation in sight. She will not have the pleasure of a goodbye. Who knows if she will cry? By the time he dies, he will not have eaten for 28 days. He will have cried for 2 days straight. He will have dictated a death note to his friends and family, reporting that it was time for him to go. 3 days before he dies, he will pull his wife's face close to him for the last time and kiss her gently on the mouth. He will die very peacefully at 5:30 in the morning in the bed that was his home for the last 6 months. His face will be frozen in a half-smiling state while gazing out of the window. It is such a strange blessing to be a part of someone's last days. I can catch just a glimpse of who they are, just a tiny fleck of their entire life process. Death is a strange business to be in. I fall in love again and again and say goodbye again and again. I am humbled. I am changed. With each death, we are changed. Thank you, Bobby, for changing me and for inspiring me to hold on to that which is precious with all that I am. You have been a good teacher.